Certain drugs are, require to be kept at a certain temperature so that they remain stable. If they go outside of that range, either too hot or if they freeze, they don't work as well, or the expiry date is reduced significantly. If we find that drugs have been out of range for a significant period, we need to throw them out, as they won't be as effective as they should. We had data loggers in the fridges, but these required to be brought back to pharmacy and downloaded. This was done once a week. One of our technicians would go around to all of the drug fridges within the hospital and collect these loggers, and then we would then download them in pharmacy. It was probably an hour a week or so collecting all the loggers around all the wards and then putting them back. And there was probably another hour or so for the person downloading the logging on the computers. With the IT department, or the Information Communications and Systems department, we saw that there was a possibility that we could use wireless monitoring. It was to provide a real-time monitoring system for the fridges around the hospital campus. I get the reports as Deputy Director. We get a weekly report for all the fridges, as well as I can log into the system at any time to view a report as well. I can also, if the temperature does go out of range for more than 10 minutes, I get an alarm through my email as well as my wireless phone within hours, and after hours it comes through to my mobile phone as well. Well, first thing, we just ensure that the fridge door hasn't been left open, or something simple like that. But if it's something that just can't be sorted out urgently or straight away, easily, we shift the drugs from the affected fridge to another fridge within the hospital, and then we get engineering to look at that fridge as soon as possible. Basically, I myself or the director can do the fridge monitoring on our own, sort of thing. So it does save a lot of time for our technicians who don't have to go around to the different areas, and can be more confident that the temperatures of the fridges are staying in range. There's less chance that we will lose stock because of fridge problems. Now we can act within, say, 20 minutes if a fridge has gone down, whereas before we could only act, it may have been up to a week before we did so.